Welcome back to Living 808. In today's Living Healthy segment, we are talking about a virus that could lead to cancer. We welcome in Dr. Susie Chen, a radiation oncologist with the Cancer Center of Hawaii. Hello, doctor. Thanks for joining us.
Thank you for having me.
Okay, tell us about this virus.
So the virus is HPV, so the human papilloma virus. There's multiple different types of strands, so different types of this virus, and there's specific ones that could lead to cancer.
Okay, what kinds of cancer could it be linked to?
Okay, so previously it had been commonly linked to cancers such as cervical, vulvar, vaginal, penile cancers. But more recently, there's been more of what we call an epidemic of them causing head and neck cancers.
Wow, okay. What are the signs that it's something serious?
So oftentimes people present maybe with a mass in their neck. So, that's one of the things that if you notice when you're shaving that there's something there, it's probably a good idea to go ahead and see a doctor about that. Sometimes people may have a little bit of trouble swallowing or voice changes. Those all can be early symptoms of head and neck cancer.
Okay. Is there a vaccine, or what happens if you find out you have this HPV?
So commonly now, there is the HPV vaccine that's recommended for children 11 to 12 years old is when they usually start. Usually it's a couple vaccines. It's a scheduled vaccine of 3 injections. And you can have it even up to age 26. So there's a certain window that they try to get the vaccine into you.
Okay, what happens if you are older than 26 and did not get the vaccine?
So it's still good to have early detection. Okay, so the vaccine, generally they're trying to get it into a child before you have the chance of having an exposure to it. So usually after 26, most people are already exposed to it. So at that point, we go to more of a screening approach rather than a prevention approach, which is the way the vaccine works. It's more preventative. So after 26, you want to be more of a screening. So if you notice any of those symptoms that we talked about, it's good to seek medical attention.
Okay, so it is treatable?
Yes.
Okay.
Very treatable. So HPV-related cancers are actually, they have very high cure rates. And so right now it's balancing that whole idea of curing someone of a cancer as well as making sure they have a good quality of life, because we don't want to cause all these problems to people with our actual treatments, because we know they can live another 20, 30, 40 years afterwards, so those things have lasting side effects.
So often when we talk about cancer, the common thread is if caught early, your chances of survival is so much greater, and that sounds like it's the same here.
Yes, correct. So, we don't have to be as aggressive if we can catch it early. So just early detection is the name of the game.
Absolutely. So should girls be vaccinated over boys, or both genders should be?
So the virus can affect both genders. So it would be a good idea for both the guys and girls to get vaccinated.
Anything else we need to know about HPV?
Well, just that, it's something that's becoming more common in our society, so it's something that just to be aware of.
Yeah, no, it's good. And now we know those letters, HPV. I'll have you say it again. What does it stand for?
Human papilloma virus.
Okay, all right. But again, there is a vaccine, so if you have a young girl, 11 to 12 years old, that's about the age, right?
Correct.
Where they would start getting this vaccine. Doctor, thank you so much for sharing this information with us. We have got a lot more coming up on Living 808 when we return. Stay with us.